Hello, everyone. Today, our presentation will be about drugs in esports. We're going to cover the common drugs that esports athletes use, why they use them, a little bit about a player's personal experience with this substance, among various other things about esports and substance abuse. So, for this next slide, I want to ask all of you this question. What would you do to be a champion? This could be in the context of any sport, not just esports. Would you train more? Would you eat right? Would you make your mental health a priority? Would you spend more energy in improving yourself? Study other teams? I know studying film is very big in football. Changing your gaming setup for the esports realm? Or would you turn to drugs to gain this picture I found, and I feel like it really captures the energy, the excitement, the relief of actually becoming a world champion. And I think this was from the 2019 Call of Duty World Championships, where this team won the Call of Duty World Championships. So many of you probably ask yourselves, why do these professional players turn to drugs? They're at the top performance of their respective titles, so why do they need an upper edge? Some use it to improve performance and increase in winnings, because streaming doesn't always make the most money for these players, or if they're just starting out, they want to get the big tournament money winnings. Improved reflexes while gaming, improved memory, which is very important for some esports titles. Improvements in motor skills. Obviously, gaming at the highest level takes a lot of fine motor skills. Helps them cope with anxiety about performing well, anxiety about competing, and it helps them to relax before the competitions, gets them in that relaxed. You may be wondering, what are the common drugs that are used and abused within esports? Many of the common drugs used in esports are stimulants, narcotics, and mood stabilizers. Adderall is a drug you may have heard of, is a drug commonly used to treat ADHD. Antidepressants are the most common drugs used in esports. Oxycodone, Vicodin is also abused. Both of these drugs are used to cause feelings of euphoria. Zoloft is an antidepressant and is often used to help them sleep. And one thing that we didn't cover in the slide was many professional players use marijuana after competing as a way to help them relax, as a way to take anxiety away. It is also heavily abused in the community. Like many other substances, when you abuse them, there are health problems. Many of these drugs do have side effects. Some of these drugs have been known to cause heart attacks with constant abuse. Also, many of these drugs are highly addictive. Some of these drugs also have been linked to kidney failure over the long term. Antidepressants can also be highly addictive and should only be used under a doctor's order. Increased anxiety is another side effect. Extreme mood swings is another big side effect that many players experience. Risk of an overdose is always an issue when you have these highly addictive substances and you build up a tolerance to these substances. And many of these esports players are young, so that leads them to be more susceptible to drug use. Since Adderall is one of the more commonly abused drugs within esports, we thought it would be interesting to kind of go into how your brain reacts to being on Adderall. So the history of Adderall, it was approved by the FDA for use in 1996, and the main goal of the drug is to increase concentration and energy levels. It also lowers the need to sleep and eat. It increases neurotransmitters, and abusing the drugs can lead to suicidal thoughts and an increase in aggression. Prolonged abuse of the drug has shown to alter the chemistry of the brain, and the effects on the brain are often compared to methamphetamine addiction. Another thing that Adderall is used for within the college sphere is it is used for a study drug because of the same effects that it provides for gamers, the increased concentration, increased focus, things like that. Nearing the end of our presentation here, we wanted to bring in some recent esports news that involves both a player's personal story and drugs in competitive esports. So, Collier Hugh Garland was a 2020 Call of Duty World Champion. He played for teams such as the LA Thieves, FaZe Clan, and the Dallas Empire. He started using Adderall at the age of 18 to cope with competitive pressure. He won his title in 2020 while actively abusing the substance. He mentioned the constant mood swings as one of the biggest red flags that he experienced. He stopped the use of the drug during the 2021 season, and he was benched by the Dallas Empire while he was at the height of his addiction because they could not trust him due to his constant mood swings and outbursts of anger. He now is clean, and he now turns to meditation instead of abusing substances to help him cope with competitive stress. Many esports organizations, as well as companies like the Call of Duty League, are starting to realize that the abuse of these drugs is starting to become an issue. So some of the things that they recommended were only those that are prescribed these substances can use the substances. There was also an outright ban of these substances proposed. New players have to be clean, but again, this is no use if they are prescribed these drugs. Also, drug testing was also recommended, as esports is trying to partner with places such as Wanda to have overreaching drug testing for all of its athletes. So overall, this will probably be something that we will start to see in the future as more guidelines come out with regards to the abuse of these substances and more things being done to help combat the abuse of these substances.